Today, we're dissecting a concerning case report detailing an outbreak of equine herpesvirus, 1 myeloencephalopathy, or EHM, in a group of older horses. This outbreak highlights the devastating impact neurological diseases can have on horse populations, especially when multiple risk factors combine. The study we're discussing focuses on an outbreak at a horseback riding operation located in the Sierra Nevada mountains of California during the summer of 2024. Let's set the scene. It's summertime in California, and a horse riding business is in full swing. But beneath the surface of trail rides and happy customers, a sinister threat is emerging. The facility housed 33 Equids, a mix of horses and mules. 28 of these animals were permanent residents, familiar with the surroundings and routines of the operation. However, 5 new horses had recently arrived on the scene. New horses can often introduce new pathogens to a stable, and that's what makes this situation so precarious. These 5 horses were brought in 15 days before the first neurological case was detected in the resident population. For the first 9 days, the newcomers were kept separate from the resident horses, a standard biosecurity practice aimed at preventing the spread of disease. However, after this initial period of isolation, all 33 equids were then integrated and kept together in 2 large pens. Sharing pens might seem harmless, but it means the horses were also sharing water and feed, greatly facilitating disease transmission if even one horse happened to be carrying a contagious agent. And as it turned out, that's precisely what happened. Within just 1 week, 14 horses, representing about 42% of the entire herd, began showing disturbing neurological signs. That's an alarmingly high percentage. The rapid spread and high number of affected animals immediately signaled that this was a serious outbreak requiring immediate attention. So, what exactly were these signs, and what did they tell the veterinarians about the nature of the disease?
The affected horses displayed classic signs of EHM: incoordination, weakness, vestibular signs, urinary incontinence, and in the most severe cases, recumbency. These signs collectively pointed to damage within the central nervous system, disrupting the horse's ability to control their movements and bodily functions. But the outbreak didn't stop there. In addition to the horses exhibiting neurological symptoms, other horses developed fever and respiratory signs indicative of equine herpesvirus, 1 infection. These horses showed signs like lethargy, nasal discharge, and coughing, suggesting that the virus was also affecting their respiratory systems. So, some horses had neurological signs, while others primarily displayed respiratory symptoms. This variation in clinical presentation underscores the complexity of EHV-1 infections and the challenges they pose for diagnosis and management. How did the veterinarians confirm that this was indeed an outbreak of EHM?
The diagnostic process involved a combination of clinical observation and laboratory testing. The veterinarians suspected EHM based on the characteristic neurological signs, but definitive confirmation required detecting the presence of the EHV-1 virus in the affected horses. The veterinarians used a technique called polymerase chain reaction, or PCR, to detect the virus, specifically the N752 strain, in samples of blood and nasal secretions collected from the horses. PCR is a highly sensitive method that can detect even small amounts of viral genetic material, providing a rapid and accurate diagnosis. While the PCR testing provided critical information for confirming the diagnosis of EHM, it's important to note that necropsies, or post-mortem examinations, were not performed on any of the horses that were euthanized due to the severity of their condition. Without a necropsy, we can't fully understand the extent and nature of the neuropathological changes caused by the virus. So, while clinical data and PCR results strongly supported the diagnosis of EHM, the lack of necropsies represents a limitation in our understanding of the outbreak. With the EHM diagnosis confirmed, the focus shifted to treatment and management of the affected horses. How were the horses treated, and what measures were taken to control the spread of the outbreak?
All the affected horses were managed in the field, meaning they were treated at the ranch rather than being referred to a specialized equine hospital. This decision was likely influenced by financial constraints and the logistical challenges of transporting a large number of sick horses. Horses with EHM and EHV-1 received a combination of antiviral medications, anti-inflammatory drugs, and antithrombotic agents. These treatments aim to combat the virus, reduce inflammation, and prevent blood clots, which can contribute to neurological damage. Typical medications used in this type of outbreak include antivirals like valacyclovir, anti-inflammatories such as flunixin-meglumine and dexamethasone, and antithrombotics like heparin. Valacyclovir is an antiviral drug that can help reduce the replication of the EHV-1 virus. Flunixin-meglumine and dexamethasone are anti-inflammatory drugs that can help reduce swelling and inflammation in the central nervous system. Heparin is an antithrombotic agent that can help prevent the formation of blood clots. But despite these aggressive treatment efforts, the outcomes vary considerably among the affected horses. 6 of the 14 horses with EHM, representing about 43% of that group, were ultimately euthanized due to the severity of their neurological signs. These horses had reached a point where they were either unable to stand or were exhibiting severe vestibular signs, indicating significant damage to their nervous systems. Euthanasia was deemed the most humane option in these cases, as their quality of life had been severely compromised. However, not all the horses succumbed to the disease. Some did recover, and 5 horses regained full neurological function by the end of the outbreak. This highlights the fact that EHM is not always a death sentence, and with prompt and appropriate treatment, some horses can make a full recovery. What about the horses that only had respiratory symptoms? Did they fare better than those with neurological signs?
Fortunately, none of the horses with respiratory symptoms developed neurological signs after starting treatment. This suggests that early intervention with antiviral medications may help prevent the progression of EHV-1 infection to the more severe neurological form of the disease. So, to summarize, the outbreak was fast and aggressive, with high attack and death rates, particularly among the older horses in the herd. The rapid spread of the virus and the severity of the neurological signs underscore the importance of biosecurity measures and early detection in preventing and managing EHM outbreaks. The article mentions that the researchers also looked at antibody levels in the affected horses. What can antibody levels tell us about EHM, and how did they relate to the course of the outbreak?
The researchers measured anti-EHV-1 total IgG and IgG4/7 in acute and convalescent serum samples collected from the horses. IgG and IgG4/7 are types of antibodies that the body produces in response to EHV-1 infection. By measuring the levels of these antibodies in the horse's blood, the researchers hoped to gain insights into their immune responses to the virus. Did the antibody levels correlate with disease severity? In other words, could the researchers predict which horses would develop EHM or how severely they would be affected based on their antibody levels?
Interestingly, the initial antibody levels, measured during the acute phase of the outbreak, didn't differ significantly between the EHM, EHV-1, and healthy groups. However, the EHM and EHV-1 groups did show a significant increase in antibody levels between the acute and convalescent samples. This indicates that the horses who developed clinical signs of EHV-1 infection mounted a stronger immune response to the virus over time. So, the horses did develop antibodies in response to the virus, but the initial levels of those antibodies didn't predict who would get sick or how severely they would be affected. The study also used a risk evaluation assay to assess the horse's susceptibility to EHV-1 infection based on their antibody levels. This assay assigned each horse to a risk category, ranging from high risk to very low risk, based on their IgG and IgG4/7 levels in the acute serum samples. However, the researchers found that the initial risk category, based on the acute serum samples, didn't accurately predict disease development or outcome. This finding suggests that we can't rely solely on initial antibody levels to assess a horse's susceptibility to EHM or to predict their prognosis if they do become infected. There are likely other factors at play, including the horse's overall health, immune function, and exposure history. What are the big takeaways from this study, and what can we learn from this outbreak to better protect our horses in the future?
First and foremost, biosecurity is absolutely key, especially when new horses arrive at a facility. The authors speculate that the outbreak may have originated with the 5 new horses that were introduced to the herd just weeks before the first case of EHM was detected. While it's impossible to know for sure whether the new horses were the source of the outbreak, the timing is certainly suggestive. As a result, the authors specifically advise that all new horses should be quarantined for a period of 21 days before being introduced to the resident population. This isolation period allows time for any potential infections to manifest and prevents the new arrivals from spreading disease to the rest of the herd. In addition to quarantine, Strict biosecurity measures should be implemented at all times, including regular cleaning and disinfection of stalls, equipment, and shared spaces. Proper hygiene practices, such as hand washing and the use of dedicated clothing and footwear for different areas of the facility, can also help minimize the risk of disease transmission. The fact that the horses were housed in 2 large pens with shared water and feeding troughs likely contributed to the rapid spread of the virus in this outbreak. Second, older horses may be more vulnerable to EHM than younger horses. The study found that the EHM cases were primarily among the older horses in the herd, with ages ranging from 19 to 26 years. As horses age, their immune systems may weaken, making them more susceptible to infections and less able to mount an effective immune response. The EHM cases were around 21 years old. For this reason, it's particularly important to take extra precautions to protect older horses from EHV-1 infection, including ensuring they are up to date on their vaccinations and minimizing their exposure to potential sources of infection. Finally, it's important to recognize that managing EHM in the field can be challenging, especially when resources are limited. In this outbreak, the veterinarians provided supportive care and administered antiviral medications, but the death rate remained high. This underscores the need for early detection, prompt treatment, and, in some cases, referral to a specialized equine hospital where more intensive care can be provided. Managing EHM in the field requires balancing treatment costs with the chances of recovery and the welfare of the horse. It's a difficult decision, and veterinarians must work closely with owners to make the best choices for their horses. What were the limitations of this study, and how might they affect the interpretation of the results?
The authors themselves acknowledge several limitations, including incomplete sampling, inconsistent clinical data, and varied treatment protocols influenced by financial constraints. Not all horses were tested for EHV-1, and the clinical information wasn't always recorded consistently. Additionally, the treatment of the horses wasn't standardized, and the choices were left to the attending veterinarian and the owner, impacting the ability to draw definitive conclusions. It's always challenging to draw definitive conclusions from observational studies like this one. However, the study does provide valuable insights into the dynamics of EHM outbreaks and highlights the importance of biosecurity, early detection, and prompt treatment. Summarizing, what did we learn from this EHM outbreak, and what practical steps can we take to protect our horses from this devastating disease?
This EHM poses a major threat, especially to older horses. Rapid spread occurs when horses mix, so early detection is crucial. Quarantine new arrivals and implement strict biosecurity measures at all times. While antibodies offer insights into a horse's immune response to EHV-1, they aren't the only factor to consider when assessing risk. It's a reminder of the complexities of EHM and the challenges we face in preventing and managing this disease. By staying informed, implementing sound biosecurity practices, and working closely with our veterinarians, we can help protect our horses from the devastating effects of EHM. Thanks for diving into this outbreak investigation with me. Staying informed and vigilant is key to providing the best possible care for our equine companions. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.